We are now moving on to our first session of the webinar. Everyone other than the speaker, kindly mute yourselves. Dr. Kinley Penjor. He did his bachelor's in veterinary science and animal husbandry from Rajiv Gandhi College of Veterinary Science, Puducherry, India, and master's in veterinary medicine and One Health Epidemiology Fellowship from Massey University, New Zealand. As a senior regulatory and quarantine officer working for Bhutan Agriculture and Food Regulatory Authority under the Ministry of Agriculture and Forests, he looks after animal biosecurity, veterinary public health, animal welfare, antimicrobial resistance, and One Health. He currently serves as the focal point for animal production and food safety for OIE from Bhutan, the founding member for One Health in Southeast Asia, member of the Southeast Asia Disease Surveillance Network, member of EPICOR, National Technical Advisory Committee for Antimicrobial Resistance, National Technical Committee for One Health, Bhutan, Technical Expert Committee for Zoonosis, and recently as a member for the Technical Advisory Group on COVID-19. I humbly invite you, sir, for your talk on COVID-19 management in Bhutan and the One Health approach.
Sir?
Yes. Can you all see the presentation?
Yes, sir.
Okay, thank you very much. Can you see the slideshow?
No, sir,
Can you
it's
see the
still in the
slideshow?
window.
Yeah. Then I would like to request you to share the presentation from your end.
Sure, sir.
Okay, thank you very much.
Now, is the slideshow visible?
Okay, thank you very much. Should I start then?
Yes, sir.
Okay, very good afternoon to one and all. At the outset, I would like to take this opportunity to thank the organizers for IVSA Pookode and the COHEART, and to all the participants who are attending this webinar online. So today, I was given the topic to speak on the One Health approach in Bhutan, and with specific relevance or example of COVID-19 management as a One Health approach in Bhutan. So for my presentations, throughout my presentation, I have broken the presentations into three topics. Could you please move on to the next slide? Yeah. So for the presentation outline, I have the introductions about Bhutan. So this is basically to set a context so that during the subsequent presentation, when I quote some examples, when I cite some informations, that time we can relate and the information is not construed. Secondly, I'll move on to the One Health approach in the country. And then I'll use the One Health COVID-19 management as an example, or as an example of One Health approach in the country in successfully managing the COVID-19 in the country. And move to next. So I'm sure many of you might have heard about Bhutan, and maybe some of you must have visited Bhutan, but perhaps many of you might visit Bhutan after my presentation. So this is basically to set a context, not to sell my country or not to promote my country, just basically to set a context. So as all know, Bhutan is a very, very small country, measuring the area of around 30,000 plus square kilometers, and with a population of 7.5 lakh populations. Administratively, Bhutan is divided into 20 districts and 205 sub-districts. The economy of Bhutan As you can see, it is very, very small. It is worth around 7.7 million, 7 million. And move to next. And then coming to the economy, Bhutan is mostly dependent on the agriculture. Around 60% of the Bhutan populations is dependent on agriculture for their livelihood. Then we have the major proportion of revenues from hydroelectricity and then from the tourism. And coming to the education sector, so Bhutan government, as per the constitution, we are giving free education up to class 12 standards. And for this reason, we have the literacy rate of around 33%. And health services is almost free, from the diagnostic to the physician consultations, and then to the treatment, it is free of cost. Now coming to the government, we have His Majesty the Fifth King Shimika Wanchu as the head of the state, and then the Prime Minister Dr. Lotus Ring as the head of the government. So we have the constitutional monarchy system of government from 2008 onwards. Can you move to next? So basically, I have given this information just because when you during the subsequent presentation, when especially on the COVID-19, when you talk on the COVID-19, these are the important factors which has played key roles in the management of COVID-19. Now, I'll present on the One Health. Now, this is all about Bhutan and setting up of the context. Now, let us take you through to the One Health approach in the country. Before I embark on the One Health approach in the country, just an anecdote or the history or a timeline of the One Health approach. How did it actually start? So, although One Health concept is a very, very new concept, but then One Health that concept, but it was there back then in 1984. The father of the veterinary epidemiology, veterinary epidemiology, Calvin Sharvey. So he coined the concept of one medicine. So in his, and he coined the concept of one medicines, and he urged the critical need of man, which include combating of the diseases, ensuring enough food and adequate environment quality, and society in which our human values prevails. So he did not say that it is human, animal, environment is coming together, working together. He did not mention that, but he has already clearly stated the concept of one health in one medicine. And then later, his idea got further impetus later, when we know that 60% of the human health infections are genetic in nature, meaning that disease can spread between human and animal. And 75% of the emerging diseases, such as Nipah, Nipah, and Ebola, and other diseases have an origin at animal level. And then bringing down 80% of the potential bioterrorism has origin at, origin at animal level. So this all informations or the knowledge or evidence promote for the One Health approach globally. Next, please. So now I will talk about the One Health at international level, just a brief. So in September 2004, the One Health concept was launched at the One World One Health Conference. Later, it got mainstreamed into the global thinking at the third ministerial conference. And then this was followed by the expert consultative meeting to formulate the best practices for One Health. And then the One Health concept was formally introduced during the 7th International Minister Conference on Animal Health and Human Pandemic Influenza in Vietnam in 2018. And in the same year, CDC of US, in collaboration with OIE, FAO, and WHO, they hosted the meeting on the theme One Health, and during which 6 key areas of actions were identified. So focusing on the One Health global network, such as this kind of networks. Then they also worked on the they also work on the benefits and the values, the added values that the One Health approach brings to in contributing and combating the zoonotic diseases and the One Health issues. Then it touched on the capacity building, planning and methods, and then also in disseminating the informations. So the first International One Health Congress was held in Melbourne in Australia in February 2017, in which more than 10,000 people had attended this International One Health Conference. Next, please. So this is all about the One Health approach at the international level. Now coming back to zooming this to the regional level. So in the regional level, in the Southeast Asia region, so we had the Asia Pacific Strategy for Emerging Diseases developed in 2005. Later, the World Bank, Master University, through the support of World Bank, they instituted a program. They developed a program aiming at the building the capacity and the response of the different sectors in combating the human One Health issues. So this was administered in two phases. In the first phase, it was from June 10 to September 2011, in which 68 public health and animal officials were trained on the disease, on the epidemiology. Later in the phase 2, which commenced from March from 2012 to 2013, in the 7 countries, in the 7 South Asian countries, various collaborative investigation projects were launched. And in the year 2014, I'm also the recipient of this One Health Fellowship Program, administered by the Master University through the support of EU, during which 24 One Health Fellows were trained on One Health epidemiologies. So we had the participants from Afghanistan, Bangladesh, Nepal, and Bhutan from both sectors. We have in total 6 participants from each country. Next, please. Zooming again, now why Bhutan did go for One Health approach? What is the trigger that really excited Bhutan to adopt the One Health approaches? As all know, Bhutan is a very small kingdom, so it is sandwiched between 2 big countries, China and then India. And we consider Bhutan as the global hotspot or the indicator for this kind of zoonotic and emerging diseases for numerous reasons. Number one, Bhutan has a rich forest cover. Around 72% of the land is covered with forest. Then on the other hand, we have 65% of population living at the rural. So there is a close interactions between the wildlife and then the humans. And as you all know, the zoonotic diseases and the emerging diseases is all coming from the animal origin. And secondly, we have a fragile ecosystem. So we are susceptible to natural disasters such as earthquake, flood, and forest fire. This bring up the issues of emerging diseases. Then thirdly, we share long porous border, international border with India and then with China. So we are again the import dependent. We import from all kind of goods. And as you all know that some of the zoonotic diseases are transboundary, meaning that disease can cross from one country to another. Then we also now, in order to sustain the livelihood of people, now we resorted to intensive agriculture farming, meaning bringing the people more closer to the wildlife. So for this reason, we consider Bhutan as a global hotspot or indicator for zoonotic diseases for Southeast Asia region. Next, please. Now, what is the problem? So, what is the problem with Bhutan going for the old approach that is in terms of dealing with the One Health issues? So, I mean, every year we reported increased outbreak of zoonotic diseases, rabies, HPI, and other diseases, brucellosis, and other. We also reported the outbreaks of exotic diseases such as Crimean Congo hemorrhagic fever, lumpy skin disease, then recently COVID-19. And then there are other issues, one health issues such as echinococcus, which is multifaceted problem, which cut with the human as well with the animal. Then we have the global issue of EMR, and then the food safety issues. So these are the issues that warrant, that call for the other sector, that brings to other sectors to work together, because it's an issue of all kinds of across the sector. Yes, please. Next, okay. So yes, what is the problem with different sectors working on these One Health issues? So Israel, what is the problem with Bhutan is, Bhutan, the animal health and human health, they were working in isolations. So although they are a very small country, but they work in isolation. So when they work in isolation, what happens? The health sector has a separate disease prevention and preparedness plan for rabies. Animal health has the same, but the issue is same. We need a collaborative approach. Likewise, during the outbreak investigation and response actions, it was done independently. Then there was no joint research. The capacity building was done separately. So these are the silos. Basically, we've been working in silos, although the issue is the same. Then on the other hand, we have the scarce resources. Bhutan being a developing country, we cannot afford to work in isolations. So the HR capacity, the budget on HR capacity, laboratory facilities, these are very, very minimal, very, very scarce. And there was no real-time information sharing between the country. So overall, although we could able to contain disease, but it is taking away our time, HR people's time, taking away the financial cost, giving more cost. So, and even from the sustainability perspective in conducting the zoonotic diseases, it was not sustainable. So all this, working in silos, same issues, being the hotspots, all this contributed Bhutan to go for the One Health approach. Yes, please. So later we realized the issues, and then we said we sat together, and then we, from 2010 onwards, then we started working together. We did not work in silos. We started working together, and to institute a system, we developed the Bhutan One Health Strategy Plan. So this Bhutan One Health Strategy Plan, it focuses in 7 areas. The first area is to institutionalize the governance and the networking and the communication system, in which we have instituted the governance system. So from now on, we have the Interministerial Committee for One Health as One Health at the national level, at the policy level, which governs or which is the decision-making body for all the One Health related works in the country. So at the Interministerial Committee Committee for One Health, we have the head of the from the bureaucratic head from the 2 ministries as the chair and the vice chair for this. Then we have the different we have the members from all the relevant stakeholders. We have members from Minister of Health, we have members from Minister of Agriculture and Forest, we have from the regulatory systems, Drug Regulatory Authority, we have from the disaster, from the home, and then we have from the environment, and then finally and also the members from the research from the universities for research. And so this particular One Health Interministerial Committee for One Health is the foundation for any of the One Health activities in the country. So this is supported by the One Health Secretariat, which has a specific GOR for, which acts as a secretariat for the Interministerial Committee of One Health, and also carries out the licensing activities with the international organizations and the other regional countries. So this is supported, technically this is supported by 2 technical committees, National One Health Technical Committee and then National AMR Technical Committee. These are the expert group from both the ministries, from human health, animal health, with diverse knowledge in epidemiology, in laboratory, in treatment, and then in sociology, and many more. So these technical committees, they support the Interministerial Committee for One Health in terms of framing the policy or in translating the information into policies, and they also guide and coach or give directions to the field to the field. So at the field level, at the implementation level, we have the district or the municipality One Health Committee, which has also the same yes, please. Yeah. So basically, this governance system is put in place to successfully carry out the planning, monitoring, and the evaluation mechanism for all the One Health activities, and also for the uh, uh, real-time exchange of informations. Yes, please. The next area, the second area for second strategic area is in terms of instituting the disease surveillance system for human and animal health. So we have through this in this area we have prioritized the zoonotic diseases. So we annually, every year, we meet together and we prioritize the diseases we prioritize the diseases for surveillance. Then we also carried out the we also put in the joint surveillance system with the standard operating procedures for outbreaks, for disease outbreak investigations and surveillance. Then we also focus on the capacity building of the people engaged in disease surveillance. And then we also have the One Health, also operationalize the functioning of One Health Hub. So as we can see at the, as we can see the pictures, so this is a One Health hub. We have the members from Afghanistan, Bangladesh, Bhutan, India, and Nepal. Here we update all the activities, whether it's zoonotic, whether it's One Health issues to this, so that we share information at real-time basis. Second, next please. Okay, and the third strategic area is on the disease outbreak preparedness and response plan. So in this area, we have developed strategies for all the zoonotic diseases with SOPs and then response contingency plans. We also build the capacity for preparedness and for response, and then we conduct simulations. So we conduct simulation on HPI, we conduct simulations on any other imaging diseases. And then in apart to this, we also stockpile the essentials. So from the laboratories, equipment, kits, and other requirements which are necessary during the response phase. Yes, please. Okay. The fourth one is on the capacity buildings. So through this One Health approach, we map out all the capacities, expertise in the country, and then we maintain the registry of the experts. Say like in epidemiology, which are the people which are good in epidemiology, which are the people who has good knowledge on and give some decisions on laboratory, on treatment at the outbreak investigation, and even in the software such as data for analysis of data. We map out these and then we maintain the registry. So this was very helpful, especially for this COVID-19 management. Yeah. And then we also strengthen the common laboratory system at the molecular level. Yes, please. And then research. I think the research is plays a very pivotal role in sound science-based decision making. So realizing this, we institutionalize the collaborative research and we strengthen the capacity in research areas. And therefore, we have also conducted numerous researches in terms of AMR, food safety, and other neglected and emerging diseases. Yes, please. So this brings up to the last thing, that is a second last thing, which is on the communication and advocacy. So we developed the One Health communications and advocacy strategy for human and animal health. Then we conduct during the World AMR Week, Advocacy, TVD. We develop the methods together. We go together to the field, and we give awareness or we disseminate informations together. Yeah. Then yes, please. And the final thing is on the final strategic area is for the engagement of wildlife and environment. Like I said, knowing that the 75% of the emerging and emerging disease has the origin at the wildlife, and then 60% from the animal, we give more importance to the, and knowing that Bhutan is almost 70% forest cover, we give more importance to the environment. So as well, there was not much activities being conducted in the wildlife, because this is administratively and technically it was in different department, although it is under the Minister of Agriculture and Forest. So collaboratively, we formalized the surveillance in wildlife, and we have conducted several research and the disease surveillance together. Next. So this brings up and to the One Health approach system, from the governance to the field implementation in the country. Now, how did this One Health approach help in managing the COVID-19 in the country? So I'll present on the Bhutan experience on the COVID-19 management in special reference to the One Health approach in the country. Yes, please. Yes, please. Yes, please. Okay. So this is the overview or the snapshot of the COVID-19 cases in the country as of 2nd November 2020. So we have in total 354 cases of COVID-19 in the country, of which almost 53% of the cases are, of which almost 75% of the cases are in male. And breaking down this into different, we have 50% of the COVID-19 cases from the quarantine facilities. Then we have 35% from the active surveillance. So active surveillance is the cases which are detected from the during the surveillance, during active surveillance. When you detect case, then we went for searching for the cases, and we detected, especially from the self-contained zones, meaning in the militaries and all. So this was from the self-contained zone, yeah. And then 10% of cases during the community screening, and then 2% from the people who visited the flu clinics. Overall, we had the first case in 5th of March. The first case was in an American tourist, which entered to Bhutan from India. So this was the first case, and it was an isolated case. There was no other secondary cases from this. Then first Bhutanese cases, Bhutanese case was detected in 26th of March. This was from the quarantine facilities for the Bhutanese who are working in other countries and returning to the country. So it was detected this. So outside of the quarantine cases, the first case was detected in 10th of August. So in total, we do not have any mortality from the COVID-19, and then this is mainly because we have very, very strong health system in the country. So we treat, we test, and then we treat the cases on the real-time basis. So as of date of the 354 cases, already 325 cases have been all recovered, and then there are only 29 cases active cases. And then on the coming to the testings, we are 47th in the Asia per million testing. We almost conducted around like 2/7 of the population's screening. We have completed 2/7 of the population screening. So we covered around like 1.7 lakh population of the 7.5 lakh population. Please. So then, going through the numbers of COVID-19 cases in the country, so we see that there's no death of COVID-19 cases reported in the country. We did not have much community transmission in the country, and we have a very less number of cases in the country. So what is working for Bhutan? So this is the question that we normally ask. And this pictorial representation, I think, is a very, it gives a comprehensive visualization of our society or our people in combating the COVID-19 cases in the country. Yes, please. So I and the government, we pick 4 important factors that are helping in containing the COVID-19 cases in the country. First one is the benevolent leadership. So as we see in the picture, we see the first picture is His Majesty the Fifth King, who visited the far-flung places even during the very heavy monsoon period. So it is the leadership of His Majesty the King, which has His Majesty King, which is resulting in the success of COVID-19 management. His Majesty the King, Fifth King, I think he is overseeing all the COVID-19 preparedness and response plan in the country. He traveled nook and corner of the country, reach out to each household, not just one time, but 7 times. 7 times as of date. He did not take a single day rest once we had the COVID-19 cases, since the emergence of the COVID-19 cases. So he is visiting all nook and corners of the country, advising people on the public health measures, on this economic, lifting the people's moral, urging people to cooperate. These all efforts are being spearheaded by His Majesty the King. So the next picture we have is Her Majesty the Royal Queen has very recently given a birth to the second prince. As soon as she stepped out of the, she did not take the maternity leave. So she has been helping His Majesty the King. As you can see, she is distributing the food, lunch to all the frontliners. So personally, she supervised from her royal palace. She supervised in cooking, and then distributing the refreshments and lunches to all the frontliners, including including the health professionals, people who are working day and night. Then the third picture you see is His Majesty the Fourth King. So although he is retired 12 years back, but he came out of the retirement, and he also, in the same vision to His Majesty King, he supported His Majesty King, and he visited the high-risk areas, reinforcing the enforcing the directives and the directions of His Majesty the King. And then we see the last photo, which was in the orange uniform. These are their royal prince and princess who also came out of their royal house and help and volunteered to reach out the essentials and implementing the public health measures in the community. Yes, please. Then we have the leadership of the government, the Prime Minister, Dr. Lotesri. He is a medical by professional, and so then he was supported by the health minister, who also has the background in public health. So these two together, I think that is like a milk and water coming together, so nicely. So they shouldered the responsibility in implementing the COVID-19 case management in the country. So both of them are supported by the technical advisory groups. So like I said, we have around 14 members. This technical advisory group, as you see in the picture. So this has the members from the animal health, from the human health, from the universities, from the international, from the people who are working at the international level, and then from the private who are working as a private. So these people has expertise in different fields, from the policy, from this epidemiology, from the document preparations, laboratory, and even in some some of the epidemiological tools such as QGIS and Stata, which are very important for during the COVID-19 cases. So these are the technical working group which actually advises the government and the people on the implementation of COVID-19 cases in the country. Yes, please. Now, the second contributing factor is the governance structure. Like I said, like I demonstrate, like I said in the earlier presentations, we already have the institutional setup for the one health approach. The same setups with little tweak. We use these governance. We have a good governance structures. So we had the committee working at the national level. So Prime Minister, he's the chairperson, supported by Health Minister and a few other ministers. So he was supported by the national task force, national task force. So spearheaded by the Secretary of the Disaster Management. Then we divided the country into different regions, and for each regions we have the same COVID-19 working task force. So who has the secretary as the head of the management. Now, if you look at the structures.
Everyone except the speaker, please kindly mute yourselves.
Thank you. This was helpful, yeah. And then, like for each COVID-19 task force at each level, so the whole this district level One Health Committee was being brought in. So we have we have the home minister who's working who looks after the security. Then we have information ministries who look after the information and communication. We have the home minister who looks after the logistics during the operation, and then the health health ministries who look after the actual implementation of this. So this all is a one approach in a nutshell. So they all come together and they discuss, and then they give directives. Then we also use the already established the communication mechanisms or the strategies for communicating to the public and to the policymakers. Yes, please. The third contributing factor is preparedness from the prevention and response plans. So as all know that COVID-19 case, it started in late December in 2019. But on 15 January, Bhutan has already established the surveillance that is fever screening at the airport, at the international airport. We started screening all the travelers using the thermal scanner. Then on 21st of January, we had the first coordination meeting on preparedness and response for COVID-19, which was chaired by health ministers. Then we activated the Health Emergency Operations Center, which has all the relevant key stakeholders working under them. So during that time, we developed during the 2-month period, we developed a strategy plan for COVID-19 preparedness and response by the technical advisory groups. Then we visited each districts and adapted or tailored the national strategic preparedness and response strategy plan to their need, as per their capacity, as per their need, as per their context. Then we also developed several guidelines from treatment, testing, surveillance, and even to the extent disposal of the COVID death cases. Then we developed awareness and communication method, which reached out to the train the health workers on the signs and symptoms of the COVID-19. We also communicate the same to the public. Then we also have conducted the simulation exercise on the case management, on the worst case scenarios, and on the lockdowns to the implementing partners. Then we we also had the stock registry of the emergency equipment such as PPE kits, medicines, and for almost 6 months. So so during all these preparations, after all this preparation, the first case we detected the first case, like I said, in 5th of March. In the 5th of March, so it is almost 1.5 month period that we had a preparation, able to develop, simulate, and then create awareness. So after doing this, after 1.5 month of doing this, we had the first COVID-19 case. So it was like a well prepared thing. So in the first case, we carried out rigorous contact tracing and limited the COVID-19 cases to just single isolated case. Then it was on 11th March that WHO declared the WHO declared the COVID-19 as a pandemic, and then from once the WHO declared it as a pandemic, then from 16 March onwards, we imposed the mandatory quarantine of travelers for 15 days. So all travelers, it is the quarantining of all travelers at government facilities at the cost borne by the government. Yes, please. Then on the 22nd of March, His Majesty gave address to the nation, urging people to come together in combating the diseases. That was very, very inspirational address, and I think people has taken it very seriously. Then on 23rd of March, then knowing that the high-risk groups are the students, so we closed down all the schools in the country from the 23rd March. And then, right, in 1 week time of closing the schools, we had the first case of COVID-19 from the quarantine facilities. Then the informations on the COVID-19 cases start developing. We get new informations, and then we knew that there are 1 to 3% of the COVID-19 cases, they have the incubation period beyond 15 days. So then we decided together, and we took the conservative approach, meaning zero risk, although there is no zero risk, but then tried to reduce the risk to a very minimum. So from 31st March, we extended the quarantine period to 21 days. That too also borne by the government. Then from the 14th April onwards, His Majesty gave the relief project. So he spearheaded the relief projects, and all the population which are affected by the COVID-19, especially the tourism sectors and other hotelers and other group of population which are affected by whose incomes have been affected by the COVID-19. His Majesty granted relief projects, so wherein they were being paid almost 12,000 INR for each individuals. Then the first case of the community case was detected in August 10th of August, and then we implemented the lockdown, national lockdown from 11th August onwards up to 31st August. So in total, we have 21 days lockdown in the country. So during the lockdown period, it was very, very smooth. We did not have even a single problem. So because we simulated this again and again, we made people, these responsible stakeholders, to understand their roles and responsibilities during such lockdowns, and the public were well informed on the lockdown procedures. So there was not much problem. Yes, please. Then during the preparedness phase, we also know taking the 10% attack rate of COVID-19 cases in other countries, we then worked on the surge capacity. So we divided the country into 3 regions. Should there be any cases in the community, and should we have 10% attack rate in the community? So then we map out, and then we stratified the hospital facility into 4 regions based on the populations and then the capacity of health. So as for this, we simulated, and then we accordingly equipped ourselves with the health facilities in terms of ventilators, in terms of beds, and in terms of any other required treatments required for this hospitalization. Yes, please. Then we developed the mitigation strategy, communication transmission mitigation strategy, with the goal to prevent and contain the spread of COVID-19 in the community. So like any other countries, we adopted the 3T, that is test, trace, treat, and then the fourth one, which is a behavioral change. Yes, thing. Yes, okay, thank you. So testing is basically focusing on making the test available to the public who needs it and making it accessible. So for those travelers coming to the country, we have the testings at the 0 day, and we have the testings during with the RT-PCR. Then we have the testing in 13th and 14th day of the quarantine period, and then on the 21 day period. So time and again we use a mix of testing kits, rapid antigen and antibody tests along with the RT-PCR tests. So in on the last day of the quarantine period, we carried out rapid antigen kits. If we detect positive, then we extend it to 8 days, 8 more days, and then we release the traveler. So this is on the testing. Yes, please. Then we also extended the testing facilities at the hospitals. So we did not want to take any risks of hospitals having to detect COVID-19 cases in the country. So all inpatients are tested, and then only negative, all tested and only negative are being admitted. Then at the OPD and IPD teams, we work in the self-contained mode, which means one batch doing everything, and then we all in all out we do this, and then we test regularly test all the frontliners every 14 days. Yes, please. And this is about the tracing, that is about the enhanced surveillance. So we have different kind of surveillance being established. We have active community surveillance targeting the community populations, and then we also have nominated the village health workers and local workers who are trained in informing any suspect case of community COVID-19 cases in the community. Then we do it active surveillance at the schools through the use of visiting the schools and testing in the schools. Then we also undertake active surveillance among the high-risk groups. So high-risk groups are people which are very mobile, which are living at the international borders. So we do this at a very frequent interval. Then we have active and passive health facility at the surveillance at the health facilities. So we have extended the number of flu clinics in the country to rapidly detect any COVID-19 cases. Yes, please. And then coming to the treatment, like I said in early, so we already have the laboratory testing and discharge algorithm, which has been developed in consultation with the district health physicians. So in general, in order to prepare for the surge capacity, like I said, we stratified the whole country into 4 regions, and then in each region, based on the 10% attack rate or the prevalence of COVID-19 cases, then we accordingly equipped the hospitals in terms of treatment, in terms of HR, in terms of laboratory, and even in terms of testing equipments. So this is how we grouped them and worked on. But as of date, we did have cases from all other regions, but to a very manageable one. Yeah. Yes, please. Yeah, and then throughout this laboratory testings and then treatment time, I think this is again the one Health approach. So in some instances, we have our animal health workers, animal health laboratory technicians who carried out testings and collecting the samples from the human. So we have people from animal health sector working for them. Then in terms of even sharing of laboratory facilities such as PCR. So in few of the PCRs has been given by the animal health sectors to the human health to process the COVID-19 cases in humans. Now the final one is behavioral change. As you all know, that very recently we have launched that launch the we have promoted launched one of the initiatives initiated by Her Excellency the Health Minister, our responsibility, which is titled as our responsibility to protect ourselves and our nation. So in this program, we have digitally worked out the activities that each person should undertake in order to change their behavior and to protect the nation at large. So basically, it focuses on the empowerment of communities and then developing the partnership with the local government in terms of reporting, in terms of taking ownership in implementing the public health measures. So this was very helpful. Now, if you go to any of the region in the country, so if you see spot 10 people, you see that almost 9 or 8 people wear face masks. So I think it's a good compliance by the public on the public health measures being implemented by the government. Yes, please. And the final and the last contributing factor for the successful management of COVID-19 is the public solidarity and dedications. So we have all people coming together together in the direction of His Majesty the King, the guidance of His Majesty the King, and the measures which have been initiated by undertaken by the Minister of Health. So we have our religious body. We are British country, so we have our religious body performing rituals, reciting prayers every day, from morning 4 a.m. to 6 p.m. in the night, reciting on the well-being and this in elevating the sufferings, especially not just in Bhutan, in the world. They've been praying for the people for the people in the world on the COVID-19. Then we have the farmers, they have come forward bringing their produce, vegetables to the country, to the frontliners, although they do not have money to give it to the government, but they are contributing at their level in bringing the farm produce to the government. We have the volunteers. We have more than 20,000 plus volunteers who selflessly volunteered to undertake in combating the COVID-19 cases. They have been used as as a means or tools to enforce public health measures in the country, then safeguarding the borders from the illegal import and illegal entry of people. And then also during the lockdown, they are the main people who've been distributing the essentials to the public. And a very touching thing is, the citizens have launched the giving back to the citizens are giving launch platform wherein like citizens can contribute willingly to the government in order to undertake this COVID-19 management plan. So very one touching story was 13-year-old girl. She only had 10. So in our currency is rupees, and in India it is 10 INR. She only had that 10 INR with her. It was gifted by her mother. So she willingly contributed her this 10 INR rupees to this citizen fund. So this is a very touching story. So overall, I think it was a grand success, and like I said, these are the main contributing factors that Bhutan could able to manage and limit zero COVID-19 cases in the country. Next, please. So this is all I have for the presentation. I hope I have presented all the required contents for these target populations. So thank you all for listening to me and once again, I would like to thank the organizers, the IBSC, Pookode, and the cohort organizers for giving me this platform. And once and for all, I'm a very passionate One Health promoters, and whenever there is a One Health activities, I'm feeling, I'm very hopeful that I'll be able to contribute to not just in the country but outside the country. Thank you very much.
Right. Thank you, Dr. Kinley. It was very good presentation, and we all enjoyed your presentation right from the starting till now. Bhutan is such a beautiful country, yeah, I think we met in Bhutan. We both, it's such a nice country, nearly 70% forest coverage. Probably not even one single country has such a beautiful. No, there are many things which we learn in Bhutan, not only from the forest coverage. You keep the traditions intact. You can see the gown which Dr. Kinley is wearing. It's called Ko, I think, no? Kecho. Yeah. So yeah,
Yes.
yeah. And so thank you, Dr. Kinley, and we'll take a few questions now. If any participants would like to ask Dr. Kinley any questions, I don't see any questions in the chat box, but if anybody would like to ask, they can please unmute your mic and ask. Thank you.
Dr. Kinley, yeah, 1 minute. It was excellent presentation. Though officially I was in between doing some work, I was listening your talk. It was excellent presentation and the presenter strategy to be followed. And anyhow, we expect more support from your side, our university, for moving forward in one aspect. Thank you. Thank you.
Thank you, sir.
Good afternoon, Dr. Kinley. I have a doubt.
Yeah, please go ahead. Please go ahead.
Yeah, apart from COVID-19, what top 5 priority diseases you are dealing with currently in Bhutan?
Thank you very much. I think this is very good questions. So one, COVID-19 is definitely a priority for Bhutan. I think this disease has been in the priority list for every country. Now the second, we already have prioritized few zoonotic as well as the One Health issues as a priority for Bhutan. One is the AMR. So I think the animal health, the human health, even the food, agriculture, environment, we are all coming together and then working on this AMR. We already has established a governance system for AMR. We have strengthened laboratory capacities. We have standardized the SOPs for culture, for detection, even the surveillance plan. We have developed the same surveillance plan. So through this Flame Fund project, I think it's a good opportunity. So through these Flame Fund projects, we have strengthened many of the laboratories. We have been conducting surveillance in the for same antibiotics. We prioritize antimicrobial panels as well as the as well as the bacteria for this project. Then the other thing is rabies. We have developed the joint rabies prevention and elimination program. So we targeted 2030. We developed this together. We are working this together. And another thing is the HPAI, highly pathogenic avian influenza. So we also have the same common avian influenza disease prevention and control plan together, simulated together, HR capacity being done together. And then we also extended this to the food safety issue. I think these are the often neglected issues when you talk about zoonosis. When you talk about One Health, these are often neglected one. So we have come together to undertake research and surveillance in the food safety. We undertake whenever there is foodborne disease outbreaks in the country. We come together, we discuss together, we go to field together, we investigate together, and we produce data together, and we do communication and advocacy together. So this was a very good thing. So likewise, we have also improved the communications and the real-time information sharing. I think this is done at a real-time basis. So there are many other priority health or One Health issues, but like I said in the beginning, everywhere we come together, we prioritize because the situation is changing, and likewise even the priority will change. So we come together and we work together. Yeah, thank you very much.
Thank you, sir.
Thank you, Nihar. Any more questions?
So there is one in the chat box.
Yeah, but I could not understand. The question is something like, it would be very nice to know how the simulation was carried out. Probably in the slide you have talked about simulation. So he wanted to know the procedure of simulation.
Oh, I think this is a very, very important question again, I think. So simulations is a very, very important part of any disease preparedness and response plan. So we do develop very good in booklet we develop very good disease prevention and preparedness and response plan. But in actual field, when you actually go to the field and actually work on this, use this document as a working modalities in the field, it is difficult. Like I said, whatever the literature says, that thing we write this, it's only the good practices. We write the good practices in the disease preparedness and response plan. But actually, when you take this to the field and when you implement by yourself, there are some problems. So this simulation is basically, to address these issues, basically to understand the roles, responsibilities during once there is a disease. So this is a very, very, like I said, it should be a very organized one. So we have to think about these case scenarios. We have to think about the participant target. We have to think about the objectives, then about the facilities, then the observers. There are so many things that is required in order to take a simulation. But like I said, it should it not necessarily be the field simulation, but we can also undertake the desktop simulations to test the applicability and adequacy, and then effectivity of efficiency of the disease prevention and control plan. So this is a very, very important and a crucial part in any of the disease prevention and response plan. Thank you.
Yeah, thank you. There's one more question which has just popped up now. Can you please shed some light on the ongoing public awareness strategy on the country in relation to the current COVID-19 pandemic? Ongoing public awareness strategy.
Okay, I think the public strategy is more like the message is more or less the same throughout the country. I think it is about maintaining distance, keeping distance, hand hygiene, coffee etiquette, use of coffee etiquette, and then reduce number of gatherings if possible. So these are the common messages. I think it's been adapted across the country. But how you organize this message and reach out to the target population, I think the use of channel and the use of simplifying the message, reaching out to the target population, I think that will change from country to country based on the context, based on the literacy rate, based on the the knowledge of the population. That is different. But like I said, we have a very professional team who look after the communication perspective. Then they also don't just communicate what they know to the public, but they also look into the Facebook, the social medias, what are the rumors it is happening. So they can, if there are any other rumors, false rumors spreading elsewhere, information, misleading information, then they correct it. Then they put it on the very, very, the government has identified few channels wherein we as a public can actually bang on these messages. So we say like Prime Minister has his own Facebook page, so we rely on this. Then we have the health Facebook page for health, so we rely on this. Those are the few channels that we bang on. So all information, what is required, we put it there, and we ask people to only believe on these messages so that we do not create any problem. Thank you.
And we'll take one last question. This question is also posed by Nihar Og. He wanted to know, how are you managing the man-animal conflict aspect of zoonosis in Bhutan? Because I think probably we have 70% forest coverage. So this will be a very important issue to address, the man-animal conflicts.
Yeah, thank you very much. I think this is a very, very important one again. So like I said, in the strategy, Bhutan One Health strategic plan, understanding that we have a rich forest covers, and then we are going for the intensive farming, and then the majority of the diseases has the origin in animal in the wildlife origins. We thoughtfully or we purposefully kept the disease surveillance and management at wildlife as a key object strategy area in the strategy plan. So of course, yes, other than the surveillance and early detections, uh, in terms of genetics and emerging disease, we carried out for any death of animals, wildlife animals. We collect these samples. We test against the probable or indicative diseases which are prevalent in the region and maybe in the world. We test against.
Sir, Dr. Kinley, you are muted, sir.
Oh, sorry. I think I've been talking.
No.
No, sir, just for a few seconds only.
Okay, so I think it is on the genetic perspective in managing the issues arising from wildlife. So how we tackle this? Like I said, we have the well-established surveillance system in the wildlife. We also has established the diagnostic facilities in order to adequately capture the any other emerging diseases or genetic diseases in the wildlife. And apart to this, we test all the whenever we see a dead animal, wildlife dead animals, we test all the animals against the indicative diseases or the diseases which are already prevalent in the region. We test against this. Then we also communicate to the public on the safe disposal of dead animals. Sometimes there are other districts we consume the wild animals. Then we by the act they also prevent the poaching and all. I think this is overall well covered. But in terms of human and wildlife conflict, that is, this is very, very prevalent in the country because we are very closer to the wildlife. So wildlife, they come to the agriculture, they forage things and they do some damage, but this was there. But I think this is very important issue that need to be, that the government is working on. So they have resolved to using the electrical fencing to ward off the animals, but this has found to be very ineffective, but yeah, government is working on this. Thank you.
Right, thank you. Yeah, I think it's time. We have crossed 1 o'clock, and I would like to thank. I would like to call upon Krishnendu for delivering the thanks. But before that, I will welcome and on part of Kinley, I will tell that you all please visit Bhutan. Bhutan is a wonderful country. But only thing, we don't even need a passport to go to Bhutan. No, you don't need to worry. You just need your electoral vote card. They are so much caring and loving for Indians. So, but one thing you have to be aware is that the airport, Paro airport, is very dangerous one. You have in 2 mountains, and only I think total of 8 to 10 pilots are there who can actually drive through that valley between the 2 mountains. So thank you. Krishnendu, can you please take over?
Yes, sir. We are indeed very grateful for the valuable knowledge you have shared with us, sir. Hello?
Yeah, we can hear you.
Yeah. Yes. Yeah.
Okay. So, this is the end of our first session.